So we're going to have him on his side. I'm going to take this arm, I'm going to pull out, he's going to hug himself here, he's stable. I'm going to take the bottom leg, straighten it out. So go over, I'm going to do 5 different types of side posture. I'm going to focus on the sacroiliac right now. And then when we do lumbar, we'll extend it into there. So the first one is what I call like drop and drive. This is very similar. This is like Gonstead style. So we're going to lower the leg down. I'm going to palpate his PSIS. I'll get the upper portion of the sacroiliac. I'm going to bring it up until I start to feel it move, and then I'm going to bring it up as high as I can until I'm going to palpate the L5-S1 until I start to feel that move, and I want to keep kind of below that so I can isolate the sacroiliac and get as little lumbar involved as possible. Then I'm going to bring the leg down. And what I'm doing here is I'm seeing how well that ilium is separating from the sacrum. So I'm palpating into it to feel how well that separates. Now I get to that maximum point, I'm going to lock it out here. Now for the drop and drive, I'm going to have my hip over his ilium, his flare ilium. When I come down, I want to create an opening of that sacroiliac, and then I'm going to drop in to open the joint, and then I'm going to drive it to actually get that flexion motion, which is more like, almost like an AP along the femur head leg. So I'm going to bring it up, bring it down. I'm going to get onto the ilium here. I'm going to take my soft pisiform onto his PSIS. I'm going to down. Now the drop here, my leg's up here because my right leg, this is where the drop happens. Come down just like this, almost like dropping like a stone down. I want to keep my elbow in tight. I want to roll him to the point where I don't have to do this. Chiropractors blow out their rotator cuffs by doing this for years. So I want to keep my elbow in tight. So I have a nice firm contact. My body position is good. I want to drop as little as possible from the waist to let the drop happen here. So drop as an impulse. This hand stabilizes. And to get a little bit more traction here, I'm going to bring it back. My table, the abdominal piece drops down. I always drop that down so I get a little more play. Here, I'm going to hold here. So hold it stiff. I'm going to relax. I'm going to drop. Impulse it. Second type is we're going to do a lock and drop. In this case, I'm going to bring it up. I'm going to lock him in here. Now, smaller doctors, or a lot of female doctors, this is a good one to use. It's not good for long term because what I'm doing is I'm blocking here, but if I was a smaller doctor, I can't really use my hips to drop down, so I'm locking in the SI, and I'm dropping down here with my upper body to get it to go. Third type is a kickstart with a push. So I'm going to lock him here. I'm going to get my knee. Now I'm going to use this foot here, but I'm going to dorsiflex to hold his knee so I can hold that joint open. This leg is going to come down onto here, and I'm going to use this as a drop in here while I do a push and drop to open. Good. And I get a little more leverage that way. Second type of kickstart, should get a little bit L5. Good, okay?
Yeah.
Okay. Is I'm going to come down in the knee, the crook of the knee. Now this one is more of a speed move. There's less specificity, and but you get a lot of torque in here. I'm going to kick here while I pull here. In this case, because I'm actually I'm on L5 this time. I'm going to contact here. I'm going to torque in and open it up that way. And the final type is relax here. If he has like that extension, or he wasn't getting that full extension, what we're going to do is we're going to lock in onto here. I'm going to hook onto his PSIS here, reinforce here. I'm going to bring his leg back so I feel a little bit of that locking out, traction up, impulse to actually separate the ilium into extension. So those 5 different kinds of sacroiliac. Oh, I'm sorry, the last one is the classic, which I don't recommend, and that is the lumbar roll. That's why side posture is not a lumbar roll. That's why we stabilize here. Same positioning, but instead of dropping on this leg, I'm going to drop down here and create a lot of torque. It is the least accurate. Sometimes you use it. Most of the time you want to avoid doing that. Okay?
Did you ever put the patient's leg in between yours?
Yes. So, okay, that's good. It's a good example. So either we can bring it up this way or bring it up like here as well to get the locking out. Sometimes I have a knee issue, prosthetic knee. And from here, you can still get onto it to drop into it. Or I can lock it here and then upper body drop. That way as well. questions?
Yeah, I like having the leg off the table because I feel like sometimes when their foot is back, it like holds everything back and I can't get the movement because their foot is like anchoring
Yes.
everything. So when I have the foot off the table, then I can get that.
Yeah.
And I use the kickstart like you said.
Yeah, what you have to use, what is it you're trying to affect? That's number one. What is the patient relaxed? Some patients only relax a certain way. And you, like I said, like I could actually get over him to do like drop and drive. If you're a woman with small stature doc, or if your tables are too high, maybe you have a table like this, but it doesn't, I mean, elevation tables are great, because you ideally, for a slide posture, you want the table to be at the tip of your kneecap. This is just a tad tall for me. And the size of the patient, big patient, you're not gonna be able to drop
Yeah.
down. You're gonna have to use the other methods. So you wanna have a couple in your toolbox, so you can actually do it, the patient and the situation into. Good? Let's practice.